Tiger Woods has serious leg and foot injuries after that car accident near Los Angeles. That's according to UCLA Medical Center in a statement that you can see here. They say they used rods and screws and pins in surgery to help stabilize his leg. What kind of recovery does Tiger face? Maria Martin spoke with one of the top orthopedic surgeons in the state to get a better understanding.
With elite athletes like this, you never want to count them out.
The road to recovery begins for champion golfer Tiger Woods.
From everything that I know about Tiger, I'm sure he will recover.
Dr. John Hyman, one of the top orthopedic surgeons in the country, practices right here in Atlanta and is a former team orthopedist for the Hawks, Falcons, and Thrashers, and helped explain the severity of Tiger's injuries.
The recovery is going to be long, we know that, but the extent of what happens in the next 48 to 72 hours with the muscle and the soft tissues in particular, that's really going to be ultimately what sets the stage for the rehabilitation that's coming.
In the statement released by his foundation, they said he suffered comminuted open fractures.
So this is a bone of the tibia, which is one of the bones that was broken in his injury. And so when the bone breaks, the edge of the bone is kind of sharp. So when it cracks, like a piece of glass, a tiny little piece can poke through the skin.
We knew the back was going to be a concern. How much of a concern would his lower extremities be to playing in the future?
It's far too early to predict, but I will tell you that pivoting and twisting on the ankle and the knee and rotation on the leg is a big deal. Some athletes have been able to come back. Alex Smith was one, came back as a quarterback in the NFL. And I don't think that in and of itself, these injuries on paper will preclude his ability to play golf. But playing at that high level that he plays at is difficult even under the best of circumstances. So I think that there'll be a challenge there. But based upon what he's done so far, I wouldn't put it past him to be able to come back.